The cause of death was listed as a drug overdose, but the medical examiner's subsequent negative TOX screen cast doubt on that initial determination. Upon receiving the deceased for autopsy, the preliminary findings indicated signs consistent with opioid toxicity. However, the forensic toxicology report revealed no detectable levels of any illicit substances or prescription medications in the bloodstream. This unexpected result necessitated a reevaluation of the case details and potential alternative causes for the fatal respiratory depression observed at the scene. Interviews with family members and friends provided inconsistent accounts regarding recent drug use by the deceased, complicating the investigation further. The medical examiner's office initiated an extensive review of the circumstances surrounding the death to uncover any overlooked factors that might explain this discrepancy. Chapter: Case Background. The incident under investigation occurred on December 15th in a residential apartment located in downtown Seattle. The initial report was made by a concerned neighbor who noticed unusual activity at the residence for several days preceding the discovery of the deceased. On the day in question, emergency services were contacted after the individual failed to answer repeated knocks and calls from neighbors seeking entry. Upon arrival, first responders observed signs of disarray within the apartment, but did not detect any immediate indicators of foul play or trauma. The absence of a response led them to forcibly enter the premises, where they found the deceased lying on the floor in a state of apparent unconsciousness, with no obvious injuries visible to the naked eye. Emergency medical personnel attempted resuscitation without success, and the scene was subsequently secured for further investigation by law enforcement and forensic specialists. The initial assumption among responders was that the situation might be linked to an overdose or adverse drug reaction due to the environmental clues present within the living space. However, toxicology screening on-site yielded negative results for common substances typically associated with lethal overdoses, prompting a more detailed examination of alternative causes of death. Chapter: Initial findings upon arrival at the residence. First responders observed a scene consistent with a potential drug overdose based on the presence of paraphernalia and the deceased's supine position on the floor, surrounded by pill bottles and empty packaging suggestive of recent consumption. However, toxicology screening on-site yielded negative results for common substances typically associated with lethal overdoses, prompting a more detailed examination of alternative causes of death. The initial medical assessment revealed no signs of trauma or defensive wounds on the body surface. Vital signs were absent, and there was cyanosis around the lips, indicative of a respiratory issue. Given the lack of obvious external injuries and the presence of drug-related items, the manner of death was provisionally classified as undetermined pending toxicological analysis. Initial observations also noted that the airway management equipment had been utilized without success, suggesting attempts at resuscitation by bystanders prior to emergency services' arrival. The absence of any signs pointing towards a criminal act or foul play led investigators to focus on the deceased's medical and drug history for potential clues. A negative TOX screen would require further examination into alternative causative agents or underlying conditions contributing to respiratory failure, necessitating an in-depth autopsy and comprehensive toxicological review. Chapter: Forensic investigation at the scene. A thorough collection of physical evidence included several pill bottles with various medications inside, including prescribed opioids and benzodiazepines. A small vial containing an unidentifiable white powder was found near the deceased's bed. Personal effects, such as cell phones and computers, were secured to examine potential drug-related communications or online activity. No syringes, paraphernalia associated with intravenous drug use, or residue indicative of recent smoking or vapor inhalation were present. A detailed inventory was prepared, and all items were placed in tamper-evident bags and sealed for further analysis at the laboratory. The chain of custody documentation meticulously recorded each item's transfer from scene to lab, ensuring continuity and integrity throughout the forensic process. Notably absent were any illicit substances or drug containers that would correlate with an acute intoxication event. Upon initial examination of the deceased, standard toxicological screening was conducted to identify potential causative agents in a suspected drug overdose case. Urine and blood samples were collected for analysis, alongside vitreous humor due to its relatively stable nature postmortem. Comprehensive panels including immunoassays and high-performance liquid chromatography, HPLC, with tandem mass spectrometry were employed to detect and quantify common illicit substances such as opioids, benzodiazepines, cocaine, and amphetamines. Histological examination of the liver, kidneys, and brain revealed no significant morphological changes indicative of toxic insult. Microscopic analysis showed normal cellular architecture and absence of necrotic or inflammatory lesions. Tissue samples were tested for drug concentrations, but all results were below detection thresholds established by our laboratory standards. This negative finding suggests that other causative factors may be responsible for the deceased's demise, necessitating further investigation into environmental toxins, natural causes, or undetected prescription medication misuse. The examination of collected forensic evidence enabled a reconstruction of the sequence of events leading to the deceased's death. Initial findings indicated signs of recent drug use, but subsequent toxicological screening returned negative results for commonly abused substances. To establish the postmortem interval, PMI, entomological analysis was conducted alongside temperature measurements from the body and ambient conditions at the scene. This multifaceted approach confirmed a PMI of approximately 12 to 24 hours prior to discovery, with a high degree of confidence in this estimation. The timeline established by these findings corroborated witness statements regarding the deceased's last known activities, but contradicted initial hypotheses about drug overdose. No toxicological markers were identified that could account for the cause of death through substance abuse alone. The absence of such evidence suggests alternative causes warranting further investigation, such as environmental factors or pre-existing medical conditions contributing to the fatality. In this case, the negative toxicology screen for commonly abused drugs does not exclude the possibility of an overdose resulting from less frequently tested substances or pharmaceuticals. The absence of detectable levels of illicit substances and prescription medications in the deceased system raises several questions regarding the circumstances leading to death. Evidence collected, including stomach contents, liver tissue, and urine samples, provided no conclusive toxicological findings that could definitively explain the cause of death. This lack of positive results does not imply an absence of intoxication, but rather highlights limitations in current testing methodologies. Expert testimony will assert that while the negative screen is significant, it necessitates a broader forensic examination, including analysis for over-the-counter medications, novel psychoactive substances, and environmental toxins. The expert would affirm under oath that further investigative efforts are required to establish a definitive cause of death. Chapter Resolution: The investigation into the cause of death for the deceased concluded following a comprehensive review of all available evidence. Initial assessments suggested the possibility of a drug overdose due to the presence of common drug paraphernalia at the scene and the absence of natural causes such as trauma or disease pathology during the external examination. However, after conducting thorough toxicological screenings, no drugs or toxins were detected in the deceased system, leading to a negative TOX screen. This finding contradicted earlier hypotheses regarding intoxication as a contributing factor to the death. The central determination was made based on a detailed analysis of environmental factors and physical evidence collected from the scene, including but not limited to temperature readings, lighting conditions, and any potential signs of carbon monoxide poisoning or other non-drug-related toxins. This finding contradicted earlier hypotheses regarding intoxication as a contributing factor to the death. These findings shifted the focus away from drug use as the primary cause and towards alternative explanations, such as accidental inhalation of a harmful substance or undetected environmental hazards. The resolution underscores the importance of a comprehensive and methodical approach to forensic investigation, highlighting that initial assumptions must be continually reassessed in light of new evidence. This investigation highlights the necessity of thorough toxicological screening protocols and the integration of alternative analytical methods when initial tests yield negative results. Uncovering substances undetectable by conventional means is crucial for accurate cause determination. The file remains open,